This week's Ask Dr. Durie comes from a patient who wants to know what were the key abstracts presented at ASCO and EHA in 2019. The ASCO meeting is held at the end of May, and the EHA meeting is held at the beginning of June. And so there were a number of quite important abstracts, and I summarized the top 10 ASCO abstracts in a blog which was published on May 23rd. And so this summarizes a series of these top abstracts. However, I would say there has been one abstract which has garnished the most commentary, and this is a report from the IFM, the French Clinical Trials Group, where the results of a trial called the CASSIOPEIA trial are presented with the lead author, Dr. Philippe Moreau. This abstract was presented in oral fashion at ASCO, and in fact is part of the presidential symposium at the EHA meeting in Amsterdam. And so what do the results show? Well, this is what's called a phase 3 randomized trial for newly diagnosed patients, and this means that half of the patients in this case received a 4-drug combination of daratumumab, Velcade, thalidomide, and dex, and those patients were compared to patients receiving just the Velcade, thalidomide, and dex alone, VTD alone. So very important comparison, and as you might expect, the addition of the daratumumab, the new monoclonal antibody against CD38, trade name Darzalex, the addition of the daratumumab increased the number of patients who responded, and in particular, the depth of the response. And so the patients who achieved a complete remission with MRD negative, where there was absence of the disease with careful testing of minimal residual disease, in the DARA VTD, this percentage was 33% versus 19.9% in the patients receiving the VTD alone. And so it's clear that this is going to be a new standard of care in Europe, where VTD is used in preference to VRD just because of availability. And so we're definitely going to be seeing this as a regimen that will be important and used widely, particularly with the upcoming availability of daratumumab by the subcutaneous route. And so, as has been emphasized by a variety of reviewers, seeing these data, this is a very important study and gives us key new information to think about and discuss with patients as options in the frontline setting.